Hello, my name is Graham Miller and I am the project lead for OMT consultancy firm. My team consists of four members being Emma, Meg, Swad and Sharaf, who will individually cover areas which we feel will enable your organisation to create a positive organisational culture. Meg will be covering magnet recognition outcome. Swad will be discussing transparent corporate governance. Sharaf will be covering the importance of promoting a fiscal responsibility across health workers, and Emma will be covering empowering consumers to become engaged in decision making. Health services are large, complex entities. Even the small rural health services have multi-million-dollar budgets and are one of the community's largest employees. This, plus the range of regulatory regimes and other controls, necessitates structures that are typically hierarchical in nature. This allows for clear lines of accountability, responsibility, and supervision of staff. What we have found as a team helping organisations similar to yours is that organisational culture can be defined as the character and personality of your organisation. What makes your organisation unique and is the sum of its values, traditions, beliefs, interactions, behaviour and attitudes. The most important part of any organisation is the people, and this is for your organisation too. Attracting the right talent and employing the right people is essential to positive organisational culture. Organisations that focus on people create positive organisational cultures effortlessly. Think of an organisation like Google who pride themselves on their creative workplace environments. There's free food, even haircuts and dry cleaning and on-site gyms. This would be amazing if we could provide this to our own staff, but unfortunately we do work in health, so finances also need to be taken into consideration. The key takeout though is to create a space where people look forward to going each day, and this can be achieved through the smallest, simplest of ways. Communication is an essential human need, just like everyday life. How I speak to you, how you speak to me. When we communicate effectively, we build strong, supportive relationships that can thrive in challenging circumstances. Regular and positive communication, therefore, assists in creating a positive organisational culture. It's human nature to seek purpose in life. The workplace is no different. Employees must have a sense of purpose. Consumers must have a sense of purpose. An organisation itself must have a sense of purpose. In an organisation, leaders who understand, engage in, and effectively communicate a shared vision build positive organisational cultures, where employees know why they are turning up to work every day, why consumers know what's expected of them and what they expect from the organisation, and what is their role in this shared vision. An individual's purpose is defined and the vision of health is clear. When people feel they are contributing to a meaningful goal, they feel happier, more positive and satisfied with their jobs. I will now hand you over to the team. Thank you.
Hello everyone, good morning. I am Swad and I will talk about the transparent corporate governance. First, I will present why it is important and what's the outcome. Corporate governance is concerned with running organization and business efficiently and within legal constraint. Hence, corporate governance is a concern with corporation management generating a climate for the acceptable returns on investment, discharging fiscal responsibilities, the control and the direction of board and executives, and the framing and conclusion process to achieve the goal. Transparency is requirement for good corporate governance. We believe that the role of corporate governance depends on the success of transparency process. Our organization has recognized the achievement of excellence in transparent governance as a significant challenge in the pursuit of the effectiveness in organization. Now I will explain about organizational culture and transparent governance relationship. Organizational culture and its undertones can either subvert or successfully implement integrated clinical governance framework. Transparency happens only when an institution creates a culture of candor and respect. Internal communication should be recognized as well as external communication, so that an organizational culture transparency represents community confidence in the organization's capability and integrity, get a piece of knowledge about employee gratification and overall qualifying ambiguity at all the level of the governance. Now I will explain and present the strategic goal and objective from our perspective. For transparent corporate governance, a new initiative is being planned, and initiative will focus with the following objective. First, I will talk about development of effective leadership. To establish a positive culture in a healthcare organization, this is a vital step to developing a leadership role where staff can understand their responsibilities and what are they thinking for the patient safety, as well as how far they are committed for their company. However, creating corporate governance through transparency, sometimes staffs are not willingly exposed to the direct statement, and at the time an issue raised for high staff turnover. Hence, our initiative are to develop an effective leadership establishment and encourage the staff about their focus and having a clear objective for accomplishing high performance. Our next objective is formation of audit committee. Our team has planned to improve standards to all the sites in healthcare through creating an audit committee for achieving the quality assessment and quality assurance. Our next goal is performing monitoring and risk management. It has been analyzed in the healthcare organization for taking a long duration for adopting a new practice in organization, especially root cause analysis. We the team are taking an initiative for looking through the root cause analysis so that we can explore the incidents and identify the specific function and process by transparency. Our next objective is staff alignment. We will take initiative to provide the support and fulfill credentialing requirements in healthcare credentiation standards and criteria in order to access the performance are constantly developed, which are directly indicate the measure improvement. So we are going to ensure they have available resource. Our last objective is knowledge management measure. With the team is being to plan about the data management and reporting and develop backgrounds of decision making group in all the 6 sites to share and use the information in healthcare organization. Now I will present the relevant policy of our company. Our policies will be transparency and accountability, which are based on ethical standards as well as openness, supportive to constructive criticism, and providing access for sharing internal information to the public for developing a positive culture in all the 6 sites of this healthcare. Now I will going to talk about the communication of this strategy both with the community people and the staff. To establish a positive culture in all the 6 sites in healthcare, we believe that the communication from the senior management about the objectives and the task of the staffs should be updated regularly with consistency. This can be attained through individual performance appraisal, regular staff meeting, sharing information by email and internet newsletter access. And our key performance measure is the efficient and effective outcome of this strategic framework will be reflected by staff satisfaction as well as compliance also, expression of trust from the health consumer, satisfaction and confidence from a patient, which can be reported from a patient survey. Board and executive have a role to play in supporting structure, approaches, and attitude to encourage consumer to participate and health professionals to operate in joint decision-making modes with patient. Thank you. This was my part about the transparent corporate governance.
Hi there, I'm Meg. As Graham has discussed, the goal for OMT consultancy is to encourage not just excellence in patient care, but also excellence in leadership, innovation, and quality of care. The Magnet Recognition Program is a voluntary program that recognises hospitals and healthcare organisations that meet these standards of excellence. An integrative review completed by Anderson et al. Suggested that magnet hospitals have superior outcomes in a number of areas when compared with non-magnet hospitals. Researchers have found that a key reason for the magnet advantage is the presence of a work environment supportive of nurses and professional nursing practice. Therefore, achieving magnet recognition across all 6 sites is crucial in portraying your health district as one who provides not only exceptional patient care, but also a positive working environment for staff. According to Adams et al., achieving magnet status often requires a fundamental shift in culture within the healthcare organisation. As a result, the benefits will extend beyond quality improvement and nurse practice development. The components of the magnet model focus on the transformation of organisational culture through changes in processes and outcomes, and also structures which empower nurses to collectively engage in shared decision making. As previously mentioned, creating a positive workplace culture is crucial in gaining magnet recognition. It is well known that nurses represent the largest group of healthcare employees and are recognised as key to mobilising efforts which enhance positive professional practice environments. By achieving culture change at not just an individual level, but a unit and hospital management level, can ensure long-lasting effects. A key component of this is recognising and encouraging Indigenous Australians as part of your workforce. It is well known that Indigenous Australians are underrepresented within the healthcare system. As a result, this has been shown to compound the health disparities experienced by Indigenous Australians and places unwanted pressure on those existing Indigenous health professionals. Indigenous health professionals can offer important inputs at different levels and sectors within the healthcare system, providing care, policy, and stimulating others to engage in system reform for better care. This input is relevant across the health system, from tertiary hospitals to rural hospitals to primary healthcare settings. Considerable research has shown that Indigenous people want support from Indigenous staff and clinicians as part of their healthcare. According to a study completed by Clifford et al., Indigenous doctors, nurses, allied health professionals, and health workers are cultural brokers that help Indigenous patients feel more comfortable and safe throughout the delivery of their care. Therefore, having Indigenous health professionals helps minimise discharges against medical advice and encourages a therapeutic relationship between patients and healthcare staff. To become a magnet facility, undertaking significant change processes is required, as well as substantial resource investment. There are 5 components to achieving magnet recognition. The first component is transformational leadership. Understanding the characteristics of a successful leader is important when influencing organisational culture. Sculpting your workforce with the attributes of a transformational leader, such as self-confidence, inspiration, and emotional intelligence, has been associated with successful leadership. The second component is structural empowerment. A structurally empowered nurse is best equipped to protect patients' rights. A magnet organisation focuses on not just improving its own performance, but also contributing new knowledge to the science of nursing. It's expected to use the latest research-based evidence in all of its practice. The third component is exemplary professional practice. Exemplary professional practice transcends the organisation itself and extends to the practice of nursing as a whole. One way to complete this is through the community outreach. Creating a committee where nursing staff can give back to the community and involve them in the decision-making process. The fourth component is new knowledge, innovations, and improvements. Indigenous health professionals reported that the lack of opportunities and funding for further training or professional development limited pathways for career progression. Providing a supportive and culturally safe workplace is the key in improving the retention of Indigenous health professionals. And finally, the fifth component, empirical outcomes. This refers to the ability to prove that we are providing the best possible care to our patients. This may be shown through evaluation of IMS data or the implementation of a quality improvement project. In order to receive magnet recognition, a set of processes and change in structure is required. These changes should enable greater empowerment and autonomy within our workforce. Policies relating to the employment and retention of Indigenous staff are an important place to start. These These have been shown to be an effective reference point in other local health districts. In order for this health service to be effective and to reach magnet recognition, it is important to include both community and staff in its development. Sessions should be held during workforce orientation prior to the facility opening, which aim at explaining the magnet process and the expectations for staff. Ongoing education and information sessions should also be held for staff to encourage a collaborative experience. Community focus groups should be held to assist in determining what the community wants and expects from the facility before any community outreach programs are implemented. As we all know, all good things cost money. Studies have shown that a hospital with magnet recognition has had a positive impact on their financial performance. This may be due to increased recognition of exceptional patient care, which in turn encourages patients to visit our facilities. It has been noted that in order to increase retention of Indigenous staff, more and longer-term funding of positions and health programs are needed to improve job security and the salary levels of those staff. Therefore, an increase in the amount of expenditure is required in this area. Thank you for your time. I'll now pass the baton on to Sharaf.
Hello, my name is Sharath and I'm going to be talking about fiscal responsibility across 100 frontline health workers. Firstly, I would like to begin with an explanation of the outcome and why is it important. Fiscal responsibility across the health workers is essential for various reasons. Well-functioning health services depend on excellent workforce retention. Organizational budget often underestimates the avoidable loss of an employee. Their expensive and incurred direct costs such as new recruitment and selection, temporary replacement, management time, and indirect costs such as adaptation, cost of learning, service quality, and significant loss of skills, expertise, and knowledge. The relationship of organization culture to the outcome. The organization culture has a vital role to play in the workforce outcome by motivating or demotivating them. Motivational factors are good management, supervisors and managers support during the problems, financial incentives, resource availability, and training programs. While some of the demotivating factors are unfairness in promotion, salary levels, and training aspects. Low-level salaries, poor human resource management, and difficulty in working conditions, lack of recognition and appreciation. The strategies recommended to achieve the outcome are with the health services demand likely to continue to grow strongly over the next decade and beyond, and the cost of employing the health workers are likely to rise. Hence, the policy changes are required to prevent future per capita expenditure on health workforce and healthcare more generally from escalating too rapidly. Furthermore, the question on the fiscal sustainability of such growth in spending will arise. Thus, it is very essential that the service delivery becomes more efficient and effective to help contain future expenditure growth. Migration, shortage, and inappropriate skill mix or poor distribution of health workers result in healthcare workforce crisis. Thus, are limiting factors to achievement of key development indicators. However, the financial incentives should be integrated with other incentives, particularly concerning migration, where it was concluded that the financial incentives alone would not keep the health workers from migrating. Nevertheless, the demotivating factors were low income, which made the health workers feel they are undervalued. Furthermore, taking a second job just to supplement their income got them overworked. Identification of relevant policies that would be needed to develop to assist in achieving the outcome. Overcoming this workforce shortage will require substantial financial commitment to train and pay additional health workers. It is clear, however, that the scaling of the health workforce on either 10 years or 20-year trajectory will require a very significant dedicated fund. This is only the cost associated with developing the future health workforce, and additional cost will be associated with other needed initiatives such as improvising incentives in order to address the maldistribution of workers, creating new cadres where needed for an appropriate skill mix, and increasing salaries and benefits to retain workers. Strong health workforce requires better health workers, education, investment from government, progressive fiscal policies, and structural reforms may be needed. Collaboration between government bodies, government physical bodies, regulatory bodies, and training providers are required. Strategies to achieve the outcome are facilitating innovations in workforce roles, through evidence-based policies and planning, identifying the distribution of health workforce, and designing programs to improve their distribution, streamline funding for clinical training, and creating more opportunities for multidisciplinary education and internship programs. The communication plan for how to promote the concept to the both community and staff. Healthcare has diverse communities working in them, comprising of stakeholders, technologists, physicians, nurses, physiologists, counselors, therapists, etc. Mutually understandable language for assessment and articulating functionality to be improvised by a shared and standardized vocabulary to facilitate alignment across digital implementation should be recognized. E-learning enables development and training to be learner-centered. Interprofessional, workplace-based collaborative training and education providers can be accelerated. The right skill development at a required scale. Consideration of any major expenditure required to achieve the outcomes. Yes, additional funding for the health workforce will have to come from national level initiatives, and at the national level there are three broad options. Increase the share of total expenditure allocated to the health workers. Without a healthy population, a country's economical growth itself is undermined. Without the needed health workforce, the key development goals related to health cannot be attained. Recurrent expenditures such as salaries for the health workforce should not be viewed as a consumption expenditure in the budget, but also as a genuine investment to improve overall productivity in national economy. Health sector leaders must engage in dialogue and negotiation to get support from needed investors. Secondly, improvising the efficiency. The argument for increasing funding for health sector human resources will be enhanced in the political arena if efficiency improves. The more efficient use of resources will also allow the funds to be spread further. However, there is evidence of significant leakage. Eliminating ghost workers and absenteeism as well as lowering costs by outsourcing could improve efficiency. Identifying the new source of fundings. Targeted taxes. For public sector's financing of healthcare, general taxation revenue should not be considered the only source of resources. Special taxes such as those targeting tobacco, alcohol consumption could be earmarked for health expenditure. Special lotteries devoted to health are also a potential source of revenue. Insurance schemes, social health insurance, private health insurance, community-based health insurance, and medical savings account are all possible means of financing the health sector.
Healthcare delivery is currently evolving in response to increased desire for consumer autonomy in the face of increased complexity of needs and diversity of care options. Redefining consumers and healthcare workers as partners in decision making is directly related to positive outcomes, including enhanced consumer satisfaction, improved innovation, and cost savings. OTM consultancy results in shared knowledge, values, and preferences, which is addressed through communication, consultation, and participation. These three key areas optimize the shared decision-making process, increasing consumer satisfaction. Organisational culture is the way in which beliefs, values, and ways of interacting are constructed and contributes to the psychological and social environment of an organisation. A positive culture seeks to optimize healthcare delivery, improving the contributions that the system makes. In order to maintain a positive culture, the engagement of consumers is invaluable in developing new service delivery methods, shared decision-making of care, and evaluation of systems. 4 strategies have been developed which seek to engage consumers and create a culture of shared decision-making. The first of these is involvement in policy development. Research shows that consumers don't just wish to be involved in their care decisions, they want to be involved in the development of the systems and policies which drive their care. The creation of consumer groups which evaluate draft policies and provide feedback prior to publication optimizes the potential outcomes of policies. Studies conducted on consumer engagement have identified that consumers which are engaged in organisational design, governance, and public policy yield systems which better support the consumer and improve involvement in direct care. This has also been particularly successful in improving consumer engagement in mental health areas and compliance with treatment plans. The second strategy is to utilise video-based education. It is imperative to recognise the diversity of the consumers you are interacting with. This includes individuals from various languages, the blind, deaf, and illiterate individuals. The implementation of strategies which can reach a diverse group reinforces to the consumer how valuable they are. Video-based education includes the development of videos around common health conditions, their treatment, complications, and common questions asked. These videos will play in general practice waiting rooms and will come in various languages with subtitles in order to capture a wide audience. This method has been shown to be effective in educating individuals of low literacy levels and in
specific CPR decision making. The third strategy involves the incorporation of decision-making models into the EMR. A criticism of healthcare consultations is their perceived brevity, with individuals feeling there is not enough time to ask questions. With many decisions requiring consideration of their risks, benefits, and options, further information could easily be provided and access to consumers as needed. Building information sheets and evidence-based information into the electronic medical record system seeks to eliminate gaps in education. When the consumer requests further information on their condition, the healthcare worker makes a selection on their medical record, sending information to the consumer's email in order for them to make informed decisions at their own pace. Systems similar to this have been implemented in facilities in the US with great success. The final strategy is to implement interactive web-based materials. Shared decision-making recognises that medical decisions require the input of both the consumer and healthcare worker. The development of a web-based interactive site which consumers can access provides a bridge between the consumer and the healthcare system. The website would provide consumers with up-to-date information on local facilities, including their policies and what is available, such as dietitians, physiotherapy, and general practitioners. The site would also provide a platform where consumers can post questions and gain further information from experienced clinicians. This interactive style increases access to care and information and improves health literacy. Creating a culture that promotes and supports the engagement of consumers in decision-making requires the development of governance and policies. Governance is necessary to enforce consumer involvement and feedback in policy development, and must be implemented. Staff education would need to also occur to appropriately train clinicians on content of information to adequately answer consumer questions and participate on the web page. In implementing these strategies, communication, education, and infrastructure are needed to ensure success. Communication will demonstrate the reasons for change and their foreseen benefits. Facility-wide education across all 6 sites will capture staff and provide them with the details of the plans and benefits. The utilisation of the intranet page across the 6 sites will allow staff working on all shifts to access the plans for change. An example of the interactive webpage and information sheets would be uploaded onto the intranet page for staff to also become familiar with. Social media has also become a popular platform for various organisations to communicate with the community. Utilising social media to inform consumers of the concept will capture an audience of a wide age bracket, drawing on the inherent word-of-mouth spread of information within the community. With a large use of technology, it is important to note that there would be financial expenditure required in order to implement this effectively. The purchase of televisions in every general practice would be required, and the cost of advertisements on social media would need to be considered also. Staff training is a considered cost for the time that it would take to adequately train the staff. Despite these notable costs to implement the plan, there are financial benefits, including decreased direct care costs. Thank you.
As you will have seen from group members, developing a positive organisational culture is challenging, however, an overall benefit for your organisation. Hopefully the key messages to take home when considering our agency is consumer and staff involvement in decision making is an important aspect of healthcare delivery, with healthcare needs and options for care becoming more diverse, with staff and consumers' desires to be more autonomous. It is important to have an understanding of this, and when examining staff and consumer engagement and decision making as to how an organisation operates directly influences the involvement of all key stakeholders and their willingness to participate in healthcare decisions. In order to receive magnet recognition, a set of processes and change in structure is required. These changes should enable your organisation greater empowerment and autonomy within your workforce. Policies relating to the employment and retention of Indigenous staff, for example, is an important place to start. These have been shown to be an effective reference point in other local health districts that we have worked with. Strong governance processes at all levels of the organisation need to be paramount in your journey so that all key stakeholders are able to understand, learn, and believe in what the organisation is wanting to achieve and strive for. Thank you for your time, and I look forward to OMT Consultancy supporting you in your 5-year journey to creating a positive organisational culture. Thank you very much.